So what are we going to do about this problem of type 2 diabetes? The management and treatment for type 2 diabetes is very much involves lifestyle changes and modifications, particularly to things like the foods that we're eating and how busy and active we are and how much exercise we take. I like to describe the management of type 2 diabetes like a pyramid, and the lifestyle changes need to be regarded as the base layer of your pyramid, really. And that is your foundation for your treatment for diabetes. So making changes to diet, to exercise levels, and to trying to achieve some weight loss must be the baseline of the base layer of your pyramid, and that remains the same regardless of the next two layers of management which come on the rest of the pyramid. If we think about the next two layers of this pyramid, the middle layer is going to be medications that your GP may think are required at a certain stage of your diabetic journey. And the top layer of the pyramid will be injectable treatments as and when they are deemed necessary in the future. However, it's not all doom and gloom. For those people who are in this borderline area of pre-diabetes or impaired glucose tolerance, the good news is that if lifestyle interventions are made early enough, about approximately 60% of people can actually stop the progression to full-blown diabetes. Those people who have a diagnosis of diabetes already, again, all is not lost, because efforts made to improve lifestyle can have a huge impact on your diabetic control, and some people have even managed to reduce or stop some of their diabetes medications. So essentially, the foundation layer of our pyramid focuses on trying to get a little bit fitter, trying to get a bit slimmer, and trying to establish lifestyle changes that you can sustain. Getting a little bit slimmer needn't be a huge obstacle or a massive mountain to climb. We like people to consider aiming for a 5 to 10% weight loss over a period of a year. That translates in real terms for somebody who weighs 200 pounds, which is about 15.5 stone, that would be 20 pounds a year to lose, which works out at about £1.50 a month. So for most people, that's relatively easy to achieve without actually trying too hard. If people make more effort and they manage to lose more than their 10% weight loss, then the gains are exponential. The more weight you lose, the more health benefits you accrue. The research has demonstrated that the 10% weight loss is very significant in that it makes metabolic changes take place within the body. We get improved blood glucose control, we get improved blood cholesterol, and improved blood pressure. Trying to get a bit fitter is an extremely important element of diabetes management and treatment. We would urge everybody to try and consider which bit of their day they can add in a little bit more exercise or activity, and we would ask you to consider adding in some brisk walking about 2 or 3 times a week, and then increasing that as and when you feel able. I'm not going to spend an awful lot of time talking about this now because Gareth, our exercise physiologist, is going to talk in more detail about that later. What we would urge people to do is to try and identify 1 or 2 useful things that they can work on now and try and make those achievable and realistic goals. Once those things are achieved and you've ticked them off mentally on your list, you can then feel very satisfied and move on to choosing a couple of new goals, and so on and so forth, until you've made some significant changes over a period of several months. In terms of our pyramid of treatment for type 2 diabetes, the base layer, again, is lifestyle changes that we can achieve, trying to get a little bit fitter with a bit more exercise, and attempting to lose some weight, which for most people is necessary.